Hi, I'm Michael Nelson with Naturopathic Specialists. It is Tuesday, April 7th, and I am joined this morning by Dr. Dan Rubin, our medical director and naturopathic oncologist here at Naturopathic Specialists. How are you this morning, Dr. Rubin?
Hey, good. Thank you for having me, and thank you for putting this together so we can disseminate such critical and crucial and informative stuff for our patients and anybody who's listening.
Absolutely, you're welcome. Well, this morning I wanted to talk to you specifically because oncology is your realm of expertise. And right now, with everything going around SARS-CoV-2 and COVID-19, oncology and immunity, I wanted to get your perspective on that.
Thank you. I've been looking at the immune system and immune responsiveness as it pertains to oncology for over 2 decades. And it is so critically important that the understanding of the interplay between SARS-CoV-2 and the immune system be understood by the public, because especially for our constituents and people who follow us or who see us, they really need this information. We have been looking at very similar activities that happens when COVID-19 strikes in somebody because it's interrelated with oncology. I'm going to give you an example. The reason this is so critical is because if somebody is out shopping or reading the internet and reads something that may be, like good for their immune system, it actually may be very damaging and could actually precipitate a cytokine storm or severity of COVID-19 should they contract SARS-CoV-2. We know the name of the virus. One of the names is SARS-CoV-2. The disease that it produces in humans is called COVID-19. What happens in the severity of the lung issues and other organ damage occurs because of something called a cytokine storm. A cytokine is a behavior molecule. Cyto means cell, and kine means movement or behavior. And the immune system in the body it responds and intercommunicates between organ systems and cell types with something called biological response modifiers. That's it. It's a simple term. One of those biological response modifiers is what's called a cytokine. And there are hundreds of cytokines, but there are a few that are specifically implicated in COVID-19 severity, causing lung damage, inflammation, and ultimately some breakdown of lung tissue. And those are interleukin 6, interleukin 8. There's one called soluble interleukin 2 receptor, which is very, very important. And those three in particular are ones that we have been looking at for years because they make a difference in how the immune system responds to cancer cells. In many of our patients, if not most of our patients who get lab testing through us, we're absolutely looking at all three of those, which means we understand how to manipulate those in the body. And so what we've posted on our website in terms of what we consider being some of the most valuable supplements for people to utilize during these times were put up there because of their ability to modify some of these cytokines. Another very important one to understand is something called interleukin 1 beta. And so without getting too complex and really getting too much into the weeds and maybe losing some people on this video, I just want to make everybody aware that the doctors and naturopathic specialists are aware of these cytokines. We know how to modulate them nutritionally. We've been doing this even long before SARS-CoV-2 or coronavirus was a pandemic. And the real notion here and the real message is please, please don't go buying things on the internet yourself if you don't know what they are or how they may modulate. Please discuss it with us. We are absolutely here to help.
Good reminders. A lot of this stuff with the pandemic is bringing out the best in human nature and humanity. We're seeing people support each other, and the doctors here are certainly doing that. But there's also, like you said, those warning signs. Some people are trying to take advantage of this situation, pushing things, saying that it'll affect COVID-19 or prevent it. And certainly you're not saying that, but you're saying you've got decades of experience specifically supporting the immune system, correct?
Just so happens what we had been looking at seems to fit very, very well, almost exactly to what's going on now, and may even affect the severity of the disease in a way that benefits the person, not benefits the disease. So yes.
Good. So how can people get in touch? Are you
Oh,
guys available?
we're available. Our website is listenandcare.com. Our phone number is 480-990-1111.
And
Give
you're
us a
available
call.
for consultations.
We are available for consultations. We have it set up so that we can do specific COVID-19 consultations, which are brief. Certainly, if you're a patient of ours and you have a consult scheduled out, a month or 2 months from now, but you want to talk specifically about what I'm saying here today, or have questions about SARS-CoV-2, the novel coronavirus, or COVID-19, we're here to help. Give us a call.
Excellent. Well, this was just a quick kind of a touch base. A lot of people are thinking about this and they don't know where to turn. Here's a good resource with naturopathic specialists. If this was interesting to you, or if you're interested about what's coming tomorrow, follow us on Facebook, LinkedIn, Instagram, all of our channels. We're trying to do this so no matter where you go, you have access to us. Well, thank you
Awesome.
again, Dr. Rubin.
We'll be back.